prošloj emisiji od doktora Erdala Karaoza iz bolnice Liv čuli ste šta su matične ćelije i zašto su one toliko važne.
Because unfortunately today modern medicine cannot treat some kind of disease such as neurodegenerative, muscular degenerative, autoimmune diseases, diabetes, Alzheimer, Parkinson, amyotrophic lateral sclerosis, motor neuron diseases, etc.
Vidjeli ste nevjerovatne slučajeve koji su nakon liječenja matičnim ćelijama izliječeni. Čuli ste da su one bolje kod novorođenčadi. O novim metodama liječenja i uspješnosti govorio je specijalista koji je za 3 godine imao preko 1000 pacijenata. Opet smo u bolnici Liv. Danas razgovaramo sa specijalistom iz oblasti hematologije. Osim metoda liječenja, uspješnosti i bolesti koje liječe u ovoj bolnici, govorit će nam i o odnosu sa pacijentima, naročito onim najmlađima. Ovaj doktor posebno naglašava ulogu roditelja u izlječenju djeteta. Kaže da je majka u svemu tome most, a otac spasilac broda. Zbog čega se najčešće javljaju pacijenti odjeljenju za hematologiju?
Mostly there are non-malignant diseases in hematology. So they are coming, for example, for iron deficiency anemia, all other types of anemia, lymphodenomegaly, and other organ enlargements. And for malignant diseases, which are called sarcomas in age group, and these are swellings on the body of the organs, for example. And leukemia.
Koje su to bolesti koje najčešće liječite na ovom odjeljenju?
There are also malignant diseases from bone marrow, which we call leukemias. In childhood, we see acute leukemias and chronic myeloid leukemia. We don't see chronic lymphoid leukemia, which is the disease of the elderly. So the prognosis we call the future of a patient prognosis. If the prognosis is good, that means for us the child will heal. So the prognosis in acute leukemias is good, is better than 30 years ago, than 20. There are so many options, therapeutic options we can use. And if we have problems with chemotherapy, with the disease comes back, we call it relapse. The relapse means we begin the therapy, and after some time the disease goes away, the tumor is zero or like that. After some time it comes back. This is called relapse. There are different relapse types of different tumors. We are specialists about that. And if a patient has relapse, we also have our treatment options. So that doesn't mean we are helpless. So from the beginning of a disease, of a malignant disease, to the healing of the patient, we are struggling with everything, but at the end we expect good results in pediatric age groups. So in this neuroblastoma patient, for example, it has more than 10 centimeters tumor in abdominal area, which is surrounding all the vessels. It was not operatable. We couldn't make any operation in that way, but now the tumor is zero. So it's a good endpoint, and we will give continuation therapy to these patients, and with this therapy we want to maintain the healing process. And after some time, we are observing our patients, and after some time, when the time for this tumor, for example, is 2 years, the waiting period, we can expect that these patients will not have this tumor anymore for some tumors. But for some tumors, we have to observe these patients for more years, for example. This depends from histology to histology, from disease to disease. Every malignant disease, every tumor is different. And if you say, for example, neuroblastoma, every patient is different. You can't say, I have this disease and this patient had these problems. You can't say that. There are differences between these tumors, and the therapeutic options are also different. So we have our therapeutic councils here, and these groups are deciding what to do in every patient in every stage of therapy. For example, we give chemotherapy, and after the fourth chemotherapy, for example, at this tumor, we make another council and see the result and say, now we should continue with this therapy, this is going well, or we should do surgery at this point, or radiotherapy. So, mentioning that, I also have to mention that treating cancer, malignant sarcoma or cancer, is a teamwork. You can't say, I am healing. There is a huge team. For example, I am the chief of the orchestra, but the orchestra must be so good and so big in order to make a good music. So our team is very well, from surgeon to pediatrist to psychologist to nurse. Everyone, translator is also important in that. And everything is for the comfort of the child. So it's difficult. I don't say it's not difficult. It's like treating upper respiratory. It's not like that. It can be. It's not easy. It's difficult to treat a patient from malignant disease. But if you are experienced, you know which problems you are facing. You will face with that drug, with that chemotherapy, with that tumor. So it's also important. So experience is the topmost important point. So for example, in hematological malignancies, every day can be different. So for example, leukemia. If you treat a leukemia, you give some drugs, some chemotherapy medicaments, and this change the status of the patient from day to day. Some chemotherapy affects kidney, the other can affect vision, for example. If you don't know the side effects, there may be a difficulty, but treating, when you begin with treating pediatric tumor, you have to gather, to have all the collections of human resources, of experience, of hospital resources. For example, you will need a good condition of the hospital. For example, if there is an old hospital and there are so many reparations in another room of the hospital, the patient may suffer from infection. It comes from air, and you have to treat infection. You will forget the cancer, and you have to treat in a hospital which is who has good resources. You don't need to treat infections. Yeah, that makes difference between treatments. What I told you, from chief of orchestra to the hospital, everything counts, and that I should call it war. We are war against diseases. I am the general of the war, and I always tell the mothers, you are the bridge, very strategic point. You are the bridge between me and the child. Tell always the fathers, you are the sailboard of the ship. If you fail, the ship sinks. So we should count the family also part of the group. They are also important. If a mother is in depression, deep depression, how can I help the child? He doesn't eat, he doesn't respond well. It's also important. If a child can't play, for example, if a child is in hospital since 8 months, for example, he needs some friends, he needs some playground. This makes difference. You know? So we all take account these things, and as we are pediatricians, child doctors, we also have to have empathy to children. It's difficult to be here, but the end results are so good that I can do that for 30 years. I'm doing that specialization since 30 years. That's very important for me, because I'm pediatrician because I love children. But in this special group, there is a difficulty for all of us. We are also human. But the end result is so good. So I feel myself in a festival. After when I send a patient home, I feel here a bayram. This is my bayram. So we are doing this well, this war against bad diseases.
Pomenuli ste sarkome. Koja je razlika između sarkoma I karcinoma?
Cancer is the disease, malignant disease of the elderly, of the adult people, and the cancer, it's a technical term, and it's the tumor of the epithelium, of the integument, of the surface areas. But in the childhood, we don't see much these types of diseases. We see other organ malignant diseases, and if the malignant disease comes from an organ, it is called sarcoma. For example, rhabdomyosarcoma comes from muscle, like that. Neuroblastoma, and there are specific names of these sarcoma. If the sarcoma, for example, comes from a kidney, nephroblastoma, like that. There is a difference between adult cancers and childhood cancers, childhood sarcomas. And not only from the point of pathologies, the pathology, the name, but the future of the therapy. The children are going well, better than the adults. They are healed more easily. Of course, the whole time is maybe difficult for the child, for the family, and for all of us. But the end of the story is better, is good. So this gives us the power, the energy to deal with pediatric age group.
Da li postoji neki zanimljiv slučaj koji bi nam mogli ukratko objasniti?
I have so many interesting cases here in this hospital because, many patients come as third line or second line therapy. Relapsed patients come to us. So these are rare diseases. I also had a patient from other country which had a very rare brain tumor, and I can say every tumor we handle here in this hospital is prone to be a journal case. So we are very interesting cases. So we do what we have learned from our teachers and teach them to our young fellows. We are not technicians, car technicians. We are handling with children. They are very important. They are more important than jewelry. They are our jewelry in our heart. So we have to be 100% doctors, not 99%. You have to think everything. I am using at the end of my slides at presentations in congresses. Cancer is not contagious. It's not contagious. It's not going to other people. Cancer you have, but love is contagious. You can give your love. So every society has its love in their heart and are helping our children. That's humanity. That's why I am here. I am doing this business.
Pomenuli ste timski rad. Kako to funkcioniše? Kako teče razgovor sa roditeljima, pacijentima, ostalim ljekarima, vašim kolegama?
Imagine a family who has hit a wall in a car. They are going on the street. They are growing a child, and at some time a disease comes in front of them and they hit the wall. Everything stops. The child can't go to school. They can't go to their jobs. This is like that. So we have to understand this, and from the beginning we begin everything slowly with caution, and the main point must be the child. The child is in the center of the circle. So we should think everything. We don't have to focus to cancer, for example, like in adults. And when we diagnose means we say this, your child has this tumor. We make some examinations, we make we make X-ray, we make tomography, PET, everything, or biopsy. We say your child has this disease, for example, neuroblastoma. Of course, there is a way of saying that the psychology of a father or a mother which has hit their car directly to the wall is not is understandable, but you can't make enough empathy to them because you don't have these feelings before. So this is a bad situation, but you should see them at the end of the therapy. If they are healed, they are flying in the sky. So from that point to the sky, you have to be with them. We are with them. We do what they need. We know what they need. It's not easy to handle a panicking mother, for example. There will be a fever, for example, and the mother is in panic because there are so many factors making them horror. But at the end, they forgot everything. And if the patient heals, what they need to go back and think what they had. So I always prefer to see the end point, and the end point will be good. We hope so. There are different parts of therapeutic options. For example, if a tumor is a tumor which you have to remove it from the body, the surgery comes as front line. If you add radiotherapy and get better results historically from the patients treated 20 years ago, for example, then you add radiotherapy to this disease. This is called studies. There are so many studies all over the world. Some studies are newly found. Some studies are old but effective. And if you can't, for example, operate, or the operation is useless or not needed, only biopsy is needed, you do that and give chemotherapy. This is called primary first-line chemotherapy. There are books about that which are written from 1970s, and made better and better with every study all over the world. Chemotherapeutic options, radiotherapy, the types of radiotherapy, the types of surgery, the types of chemotherapy are different, and not like this, like 40 years ago. But the main aspect is like that. You have a protocol. Of course, we do these classical protocols at first line. But I told you earlier that there is a fact of relapse. If a tumor relapses, comes back, you should also have something in hand to give to patient, to the parents. We have these therapeutic options in hand. We do what we can do. We are all times with the family. We can't say we don't treat. This is not our decision. So newly, since 15 to 20 years, there are some improvements in therapeutic options. These are called, these drugs go to the specific site of the cell which is ill, which is malignant, and block that site, and this cell goes to healing. For example, there is a chronic myeloid leukemia. You treat it with one tablet for every day. This was a big disease for 20 years ago. This is a disease we had to go to transplantation. We used some other drugs, but now you treat a leukemia, imagine that, with one tablet. The patient, the child, drinks one tablet every day. We follow up the patient, and he is or it's normal. This is so I'm enough old to see before and today. So this is promising. The future of the oncology is also promising, but today we can do something with these drugs. So if our way stops, we can't do anything. We have also the options of bone marrow transplantation, for example. We send to bone marrow transplantation these patients, and bone marrow transplantation is also developed all over the world. They know what they do and the prognosis and the therapy. The drugs are so effective. We are not hopeless. We should go from classical way, what we know. There's a saying in us, which way you know is the shortest way, the way to the end. So if you make mistake, you go around and don't find the target. So we have to make a decision which way to go. If you make a good decision at the beginning, the end point is good. Diagnosis is very important. To make a good diagnosis, I forgot to mention the pathologist. It's also important. The thing changes. With one word, everything changes. The chemotherapy, the radiotherapy, surgery. With one word, with one staining of a preparation of the slide, the pathologist's last word is very important. The radiologist is our eye. Without radiologist eye, we can see. We see, but this is a specialist. So we need everyone in our team. The team is important in chemotherapy, in radiotherapy, in everything is made with teamwork. Teamwork is very important. Our experience, we can say what we can decide what we need. For example, if there is a tumor at kidney or some tissue, we can predict what it comes from. In leukemia, we can diagnose leukemia from a peripheral smear, for example, with a simple microscope, with a simple hemogram. In a tumor, if we decide what kind of tumor this can be, we make predictions. So we say this patient will need radiologic examination first, or surgery first, or this first. And of course, there is a classical pathway. You need surgery at most points of a treatment way, but we don't make whole operation at every patient. If, for example, we suspect from a radiological picture from this type tumor, we can do only biopsy. If you have enough experience, you can say that. But if you don't have, you operate everything that comes to you. So the importance of this council is that at that council we decide what to do. In our hospital we can do everything what can be done at the world. So, but which you use depends to doctor.
Doktore, hvala vam puno na vremenu koje ste izdvojili za nas.
Thank you.
Doktora Pak će u Crnoj Gori biti 15. aprila. Konsultacije možete zakazati na broj telefona 068 520 006, na mail montenegro@livhospital.com.tr ili preko Facebook stranice Live Hospital. Dodatne informacije možete pronaći na sajtu www.livehospital.me. U narednoj emisiji čućete šta sve liječe na odjeljenju dječje hirurgije u bolnici Liv, kako funkcioniše tim, koliko uspješno liječe neuroblastom, zašto su i sami ljekari ponekad djeca.